Well, new at 5:30 tonight. In recent weeks, we've seen South Korea show success in managing the COVID-19 outbreak in their country. Well, data shows the country has reported only a few dozen new cases in the last few days compared to hundreds they were reporting last month.
In South Korea, new diagnosed cases on Monday dropped to 47, the lowest number the country has seen in weeks. According to the resident I spoke to, that's due to South Korea's people strictly following stay-at-home and other prevention guidelines. Isaiah Perez, born and raised in Bakersfield, moved to Seoul, South Korea in 2007. Perez, the brother of 5th District Supervisor Leticia Perez, says he quickly fell in love with the country and now permanently calls Seoul his home. When the COVID-19 outbreak first hit South Korea in January, Perez immediately saw safety precautions put into place.
They started to distribute hand sanitizer and face masks on the subways and on the buses.
Perez adds the government didn't shy from communicating with its people.
The government started sending warnings to your phone, and they developed this app where it allows you to see where everyone has been, who's had the virus.
The number of newly diagnosed cases dropped to 47 Monday, down from 909 at its peak on February 29th. The U.S. had nearly 30,000 new cases Monday. However, South Korea's population is equal to only 15% of the U.S. A fair comparison would be comparing South Korea's cases to those in the state's west coast, California, Washington, and Oregon. Together, those three states had nearly 1,500 new cases Monday.
So I know it's frustrating. I really do not like being in my house for now almost 2 months. But, it's given me some extra time to spend with my wife and my daughter.
Perez credits South Korea's success with surpassing the curve to residents simply following the government's guidelines.
Kind of like a cultural thing. Like if the government tells you to do stuff, people just go along with it. And they kind of realize that, this is for the betterment of people. They're protecting their families.
He says it's the cultural difference that has really made an impact.
South Korean people don't physically touch each other for shaking hands. So there's kind of they do this bowing thing as it is.
On the other hand, South Korean officials credit widespread testing with helping manage the viral spread. Still, Perez encourages all Americans to simply follow the guidelines and says that together we too will get ahead of the curve.
Their mindset is totally different as far as the masks go, because they do not wear masks to prevent themselves from getting sick. What they do is they wear the mask when they're sick to not get other people sick. So they're more community-minded.
Amber Frias, 17 News.
The U.S. Secretary of State says 45,000 Americans have been brought home from overseas, and the State Department is still working tonight to bring back more.
Our teams are printing emergency passports to get these folks back. We call hotels to find spaces for U.S. citizens to sleep, to make sure they're near the airport for the moment that the plane will arrive. And we make arrangements for flight crews. And we provide Americans with letters for safe passage.
Secretary of State Mike Pompeo says this mission has involved 75 countries and nearly 500 flights. He also says the U.S. is working to help other countries during the pandemic. The U.S. has banned exports on medical supplies for now, but Pompeo says they are committing $215 million for aid.
All right, back here at home, Easter weekend is approaching, and that is the subject of tonight's 17 interactive feedback poll. We're asking you, do you think people should stay away from public parks this Easter weekend? Here's how it breaks down. A whopping 94% of you say yes, we should stay away from the parks this Easter weekend and practice our social distancing. Just 6% of you disagree with that idea. Here's a look at some of your comments tonight. Rick Shergill says, stay home and celebrate in your backyard. Gina Rivera says, stay home. As Governor Cuomo stated, it's not about your life. You don't have the right to risk someone else's life. Still time for you to weigh in tonight. You can call or text us at 888-4617. Press 1 if you think people should stay away from public parks this Easter weekend. 2 if not. You can also text, tweet, email, or Facebook your comments to us. We'll have more of your comments, and we'll update the numbers coming up on 17 News at 6.
Well, we are at least 1 week and possibly 2 weeks away from an expected surge in coronavirus cases here in Kern. So we wanted to know who is keeping tabs and calling the shots in Kern County on a broader scale. Our Robert Price ventured out, mask in place, to find out.
A handful of Kern County officials, led by Chief Administrative Officer Ryan Alsop, have been huddling daily since March 17th in a gated, secure county building, preparing for a worst-case scenario they hope does not play out. So far, relative to many parts of the country, they've been fortunate. Alsop and other stakeholders, including school district leadership and public information officers, are all but sequestered at the Emergency Operations Center on Panorama Drive, a local, much scaled-down version of a situation room, in regular contact with the County Department of Public Health, as well as county public safety agencies and the city managers of Kern's 11 municipalities.
We've got a small but mighty county staff in here. This is the Emergency Operations Center. We have opened in support of the Kern County Public Health Department, who has incident command over the response to the COVID-19 crisis in our community. We have regular calls with city officials all across this county every day, school district officials, and other major stakeholders to ensure that we're all working together.
Concern number one, what if local COVID-19 cases approach or surpass the available number of beds, as has happened elsewhere in the United States and around the world? Answer, they're continuing preparations at a field hospital of sorts at the Kern County Fairgrounds.
So we've identified the fairgrounds as that site. We'll mobilize a team, a large team of people, obviously, in the event that we've got to do that. And we are, I believe we are well prepared to pull the trigger on that plan when we need to. The other thing that's happening out at the fairgrounds is that we've got 15 trailers. So in partnership with the state of California, who purchased the trailers for us, partnership with the city of Bakersfield, the Bakersfield Kern Regional Homeless Collaborative, the fairgrounds will be used as the site for homeless individuals who test positive for COVID-19 as a place for them to be isolated.
On any other spring day, the sight of these RVs would be good news. But in this case, these are emergency shelters for homeless people who may test positive for COVID-19. That hasn't happened yet. No positive tests. But the county is ready for them with these RVs.
We hope we don't have to get there, but we've got to be prepared to move in the event that we have to, because once that decision's made, and then if we start planning at that point, we're in trouble. Yeah. So we are preparing for a worst-case scenario, which I think is our job, frankly, and we're doing it smartly.
Come September, these exhibition halls at the Kern County Fair will be full of caramel corn, cinnamon rolls, and happy children. But right now, County EMT is turning them into overflow hospital beds. Hopefully they won't be needed. For 17 News, I'm Robert Price.
And you might remember that the county's new navigation center for the local homeless population, under construction since December, was supposed to be open right about now. Alsop tells 17 News that the low barrier housing facility should be ready to go any day now, but a decision on whether it is best to keep it closed during this public health crisis passes is one that local officials will have to consider, and consider it very soon.